So without further ado, over to Zoe from Hackney.
Amazing. Thanks, Gunter. Can everyone see my screen? Lots of small things on it.
Yes, we can.
Amazing. Thank you everyone for coming, and again to LOTI for the support for us on this work. So we did our first show and tell a couple of weeks ago. I think we've probably lots of people here weren't in that, so I'll do a quick summary of what we shared last time before going through what we're going to cover today. You'll be hearing from us, the team at both Hackney and Newham, but I'll let everyone introduce themselves when they come on. But my name's Zoe. I lead the change support team in Hackney. And we've been working over the last year really specifically on our immediate coronavirus response, but also really trying to think all the way through about how we take all of the really good and positive ways of working that have come out of the pandemic and make sure that we embed them as the new normal rather than just chucking them away when the immediate crisis ends. So the background to this project is that we started talking with our colleagues in Newham and realised that we'd had really similar experiences of the pandemic, in that there were hugely improved ways of working and partnerships with our local voluntary sectors. And because of the new sort of sense of urgency, I think a bit more focus for both of us across the system in terms of thinking about how we can be quite proactive in identifying vulnerability, rather than just waiting for people to present at statutory threshold sort of levels. So it was really interesting to see how similar our experiences were, and that we were both thinking about looking at the sort of social prescribing model. How can we help more frontline staff across more of the system to adopt that sort of social prescribing model? So we started with a couple of hypotheses. So we're putting this mural board contains all of the work that we've done. We started with, bear with me while you see lots of text, 3 hypotheses that was sort of the work that we'd both been doing over the last couple of months. A training program that well delivered short training modules for VCS and frontline staff would increase the number and quality, crucially, of referrals made. That peer support sessions designed by users can improve staff well-being and therefore skills and engagement with residents. And that simple technology can create a streamlined and valuable referral process. That's where we started from. We have those things all in sort of prototype form that we've all already been delivering. What's been really useful about the discovery process we did, so that's the sort of agile jargon for the sort of research phase at the beginning of a project. What we've found in the sort of 3 weeks or so that we've been doing discovery together is a much more specific hypothesis here, which is that just making referrals isn't actually the whole picture. That for lots of residents, it's not as simple as just saying, oh, here, you need to talk to adult social care. They'll give you a call and everything will be sorted. That actually where there's really big issues of trust and engagement and making it easy for residents to engage with us, that we need to do a lot more. And we've started to develop thinking around a link worker model. So what I'm going to do is hand over to Claudia to talk a little bit first to show you our digital tool that we'd already created, and then have her talk through a bit more how we're going to use that in different ways with this link worker model based on the insights that we've developed with our staff and residents.
Thanks, Zoe. So we first developed a tool called Better Conversations last year in response to the first lockdown as a way to support our COVID helpline when speaking to residents and giving them different topics to discuss, so making sure that they could have holistic conversations and had the information they needed, and also as a way to search for services that were relevant for resident. And what we've done since then is update it and improve it and imported lots more services. So we have almost all of the, well, as many as we know of the voluntary sector services within the tool, and also council services, which was something we didn't have before. and we're further developing it now, just working on the interface and the usability. And what it allows you to do is enter the resident's details at the top. And then if you're on the phone with the resident, or if you've been emailing them and they've discussed a topic that you're not quite sure about, like food, for example, and wondering how they might be able to find food, then it will bring you different options and questions that you can ask them, or bits of information, for example, about free school meals, or different things like the Rose vouchers and the Fruit and Veg project. What it then allows you to do is find those relevant services. So, for example, if you're looking for services around immigration advice, you can open that up, and this is our testing site, by the way, our staging site, so these aren't real services. And then you can either refer someone directly through here, so in that employment one, where we've got a referral email for the service, you can submit that directly through here, and it will send a receipt to yourself as the referrer, so you know that that's gone through, and also to the service. And you can get consent from the user, and you can also ask the user, the resident, if they want to be sent a receipt themselves by email or text. I think what you just saw as well is, as I was going through, it doesn't go through unless you put in information. So what we're really trying to do is encourage people to have as detailed referrals as possible, and also share the wider context of the residents, so that they don't have to keep repeating themselves if they're being passed from one service to another. You can also share detail. It makes it much easier to share details of services with the residents. So you just have to check the box in those next to the services above, and then it pulls them all through together here. And you can add more detail here if you want, so send more of a personalised email, and then you can send that to them too. I mean, what we know is that digital tools alone don't change behaviour, and don't meet all of the needs that residents have. And what we are trying to do through this project is really understand what else needs to go on, what else needs to change to really support residents from reaching crisis. And while we can increase the number of referrals going through, that won't necessarily mean that the experience is any better for the resident. So, for example, we have a very, very small voluntary sector organisation called Woodbury Aid, who are very local and know the residents around them extremely well, and do a lot of work with them. And they built a really strong relationship with someone who was very mistrusting of the council and services, and nervous to kind of approach council services. And in some cases, they might not have been comfortable passing them over to a specific council service, but they built, through the food parcel referrals we've been doing over the past year, they built a really good relationship with someone on our COVID helpline, who they knew by name and who they trusted would carry this relationship and this trust forward with the resident that they built. So they spoke to that person and handed over the resident and the relationship to that person, who was then able to work with the resident and get them to engage with other council services, navigating those services for them, and link them up to places like the housing and the benefits teams. So just looking at that, sort of the importance of that relationship, and that's what really came out of our discovery phase in this project, is realising that the trust between resident and the person they speak to is highly important, as is the trust between services and voluntary sector organisation and council services. So really focusing on that as a way to support people and to make sure they actually engage with services and don't drop off. So the approach we're taking in Hackney is trialling link workers. So this will be based on the example that I just mentioned, and we'll actually be using 2 members of staff from our helpline and positioning them as link workers. So they will act as direct contact for voluntary sector organisations or other frontline teams in the council who are maybe more specialised relationships with residents, and are maybe concerned about referring them somewhere and then maybe not following through with that referral, or if it's taking a long time for the referral to get back, so helping to navigate those services. It also acts as a way to a kind of feedback loop for the link workers to be able to see where are there difficulties for residents getting into services and feeding that back directly to those services. So we're not just navigating the chaos, but also trying to manage it as well, and improve the way that people can engage with services. So what we're doing next is we yesterday ran a second co-design workshop to map out the pathway of how these link workers could work in practice, what they need from other services, who can refer in and how. And we'll be refining that over the next week or so, and then starting to pilot those 2 link workers over the next couple of weeks. So I'm going to hand over to Helena or Phil to talk through Newham.
I think it's me, Claudia. Thanks so much. And we're really excited by the link worker model, and we're dying to see the learning from that. And we're trying to embed some of the characteristics of the link worker into some of our frontline workers. And we're halfway through the discovery phase, and we're at workshop 2 next week. But we're going to talk about what we're doing, what we did last week in workshop 1, which was to identify 6 residents' journeys through the lens of unemployment, and those 6 residents present quite differently. They have different demographics, different situations, and we just need to see how each of those case study plays out to give us a feel for the sorts of service support that they need across the council and the VCS. And Marla, you're on the call, aren't you? And you're leading one of those resident journeys. So I'm going to hand over to you. You're the Director of Skills Enterprise, aren't you, in the borough? You're used to working with residents who have lost their job. Give us a feel for your case study.
Yeah, thank you, Phil. Oh wow, that was a really lovely model. I'm so excited about the model. Yeah, I'm Mala, and I'm projects manager at Skills Enterprise. So I'm happy to share with you, our client and their case study as well. So this is a very lovely client, and her name is Rabia, and she came to our organization, Skills Enterprise, and she was referred to our organization from a local school where friends of Rabia told about our organization, and she came to our organization. And she introduced saying that, she's on universal credit, but she's having issues accessing her journal because of her lack of digital skills. And she's having 4 children, and one child is disabled who's 13-year-old, and she's also having ESOL issues as well. And she says she is living in an overcrowded accommodation. Her accommodation is a 2-bed accommodation and supported by the council. And she also says that her husband has got lots of credit cards, and they find it very difficult to manage with the money that they have got. Even though she's on universal credit as well, but her husband is doing a cab job, but they're not able to get more income into the family, and they find very difficult to manage the debt. And there is a lot of money issues in the house, and because of the housing situation and because of money issues, and she is feeling very tired, and her mental health is she really feel like her mental health is going down. But she says she did work back home in Bangladesh before coming to England, and she used to work as a nurse there. So this is the journey of her client, and she really wanted to get help into digital skills and also into ESOL as well. So she is much able to help her family and also ease the tension between her and her husband, because this is moving kind of towards domestic violence issue as well. So this is a journey of our client. This is a case study that I like to share. Thank you.
Marla, thanks so much. And it just really illustrates just how complex each case is going to be. And I was trying to add up the number of referrals into different support services we might need to help that family, and it's considerable. And what we need to build into the JDs and the approaches of all of those support workers who support that family is a bit of those link worker skills that Claudia and Zay have hinted at. And what we mustn't do is ever get this person lost in the system between referrals. How do we holistically wrap around that person? So Claudia, if you can just give us if you can zoom into our next steps, if you wouldn't mind, on the go to your left. Go the other way, I think. So just those blue boxes. So Whoa, here we go. Yeah, so we're halfway through our discovery phase. So next week we have our second workshop, and we just need to unpack these 6 case studies and work out the communication around how it should work to best support those residents and bring those services together in that holistic wraparound model. And we'll be watching with real interest your link worker model, but we feel in Newham that there's an element of each member of the system who provides a support service to have some of the qualities of the link worker, and to understand that there is a passing on of the baton of this family to another support service. And how we do that, we're trying to figure out in this discovery phase. Claudia, I'm handing back to you.
Thanks. So we've got some questions for you. But firstly, I'll just have a talk through where the sort of point at which we're at. So we're almost halfway through this project, and at the moment refining the details of our solutions and using those co-design workshops to think about what that looks like. And then in our next sprint, which will be from the 26th of April, we're going to be starting to test out those prototypes with residents, and in our final one, evaluating them, and also putting together a toolkit for this approach and preventative ways of working, which is something we want to share with other councils. So in our next show and tell, we're going to be presenting some of that and asking you about what you would find helpful to include in it. But we've got a couple of questions for you today as well, and also want your questions for us. Firstly, just wondering if anyone else has had link workers in your council or your organisation, and if you think there's anything we really need to consider in setting up this model. Or if you've ever set up training programs for frontline teams, either in the council or with voluntary sector organisations, and also what challenges you face with referrals yourself. I mean, we've learned a lot from both of our co-design sessions and our discovery, but and there are universal things. But is there anything that we've missed out that you think we should take into consideration?
Thanks, Claudia, but also really happy to take any other questions that people have for us too. Eddie, no.
Whilst people are mulling with their own questions or in response to yours, I think it's just fascinating to see this work, and given everything we've seen from the COVID experience about wanting councils working much more hand in glove with VCS partners, really trying to make sure that works really well. I guess almost thinking beyond this project, it feels like one step is we've got lots of different services by different organisations at the moment. Can we help triage them and get them to the right people in a really coordinated, intelligent way? Do you see beyond this a chance to really for councils and VCS to reflect on that complex service landscape and go, actually, we could do away with some service lines or completely integrate some altogether? Is that part of the feedback that could be possible from this process?
Yeah, it's a good question, and it's one we talked about quite a lot yesterday, and I think I'm certainly very wary of looking at a really complicated bureaucracy and putting more bureaucracy into it. That doesn't really feel like an answer. So I think one of the things that we've been talking about is it only makes sense to bring in these sort of extra link worker roles if they are explicit and in the minds of senior stakeholders, if it's explicitly clear for them that part of what these link workers is doing are making recommendations back on this is where there's a problem, we need a business process change, not just I'm an extra person who's here as failure demand. So I think that's really critical. Obviously that comes down to talking with our senior stakeholders about lots of other complex things, and people get very anxious about risk and all the rest of it. But I think that a part of what we're trying to do is do all of this work in being really open about what insights we're collecting, so there's a really clear body of evidence to help make that case to stakeholders, and I think the evaluation will really support that. But I think so definitely there will be some overlapping services, but I think the other thing that we've really heard from all of the frontline staff is that, and from residents themselves, is it's being asked to repeat the same story every time you get handed on to a different service. That is either traumatic because you're repeating a sort of story of trauma, or it's really difficult because you might be explaining yourself in terms of, I don't know, a past offence or why a relationship broke up or something is not ideal. And one of the challenges we hear is that everyone says, I need my exact referral form written in my way, and you can't possibly share information from my conversation with someone else because of very vague GDPR claims. So I think lots of these things are really hard, but if we can improve the information sharing between services, that would go a long way to taking some of the really real frustrations out of residents' experience and staff experience.
Because
So
Zoe,
if that was the only thing we could do, that would be great.
Zoe, if I could come in there, Edward, you're talking about a massive systems change, aren't you, and bringing partners together.
Sorry,
and that's
yes.
but that's great, and it's quite a journey. And what's happened over the pandemic, I think, in both boroughs, is that we've probably done 3 years merging of services in 1 year, and what we've done in Newham is we've identified the huge big issues around social welfare. What are they around unemployment, immigration, early years, all of these things play out at the position of a food bank or something like that. And we've just gone for a big training program where we just try to bring all the partners together over those issues and try and identify the big 3 things that residents are asking for support on, and seeing if we can bring those networks of not only VCS and council, but also primary care partners, and bringing all those together into some kind of networking arena has been really, really helpful. And I guess now, after a year, we now need to go to that next stage where, well, how do we streamline this? And what's happening on our training program? Originally, let's just take employability and all issues around debt management, etc. Originally, that we went for our council in-house service. Now it's co-presented, that training program, to all our frontline workers by CAB, Community Links, and our in-house service. So I think the systems will come together, but I think what we've done and Helena, you might want to come in here, over the last year, have we broken down barriers and earned trust hugely, and it's quite a long-term process, but the pandemic has enabled us to speed it up. Helena, you might want to say a couple of things on that.
Yeah, no, I think as well, what's through the training program, a mixture of the deliverers from the voluntary and the council services, meaning those people that have attended and making the appropriate referrals to the right team for them. So citizens advice fed back, they're getting more referrals, but they're actually a better level of referral and appropriate for their service. And if it isn't, they know to refer into the council. So it's kind of naturally unfolding that the people are getting referred to the right service.
Yeah, and a really good example, yesterday I had a really good in-depth call with Care for Cali about some immigration issues, but they were referring back to the training program and talking to Bethan from Praxis, the immigration lawyer who presents those programs, and the insights they had gathered from the training course and subsequent conversations was exactly the kind of network we want to create in the borough. So really exciting thing. We haven't quite captured that in the evaluation yet, but it's coming, Helena, isn't it?
That all sounds really positive. Thank you. And I'm just struck by, if you look at the work of people like Hilary Cottam, looking at the start with the individual, let's design to serve their needs out. Whereas you're right, we've got to go through this transition process of, at the moment, we have got services, many of which have been siloed. Let's at least start breaking down the barriers, breaking down the information barriers as well between them, and then strategically we can start shifting to more of that person-led approach. But that's the work of many years, not of one brief project. But great to hear the steps you're already taking. That's wonderful.
And I should say on that note, we've got Sarah on the call, who's a colleague of Hilary's at IIPP at UCL, who's going to come and help with some of the evaluation.
Fantastic.
Really help us think about those approaches. Sorry to put you on the spot, Sarah. I'll just big you up. Yeah, we'll start talking today about the approach we take to that and the timeframes. But I'm really excited to be able to put some of that theory onto this. Super. Thank you, everyone. I think we've got another show and tell scheduled for sort of towards the end of May. Is that right, Yenta? So once we've got some more of this actually tested and delivered.
Yeah, we do. And as always, we'll share details nearer the time.
Super. Thank you, everyone.
Brilliant.
Just to say, yeah, thanks everyone, and thank you, Claudia, Zoe, Phil, and Helena for presenting as well. Thank you.
And our guest star Marla today. Thanks so
much.
Marla, apologies. Yes.